When HAJARA MUKYALA discovered she was HIV positive, her husband disappeared. Without his support, she wasn't able to travel to the clinic where she was receiving treatment, here in Uganda's capital, Kampala. She gave birth to twins without any measures taken to prevent transmission. Nakato, her youngest, was negative. But Babire's had coughs, rashes and a growth on her chest. Only after 3 months was she tested, diagnosed with AIDS and given treatment.
I reach a point when I feel tired of taking the drugs. My child is going to take these drugs until she dies. She is going to die taking the drugs because I gave it to her. Had it been prevented, she would not have to take them.
HAJARA is now back on the antiretroviral medication, but Babire started it too late to stop her getting sick. In HAJARA's neighbourhood, most of the housing is basic. There are a few jobs here. One of the only ways to get by is informal trade at the side of the street. Many of the healthcare services that are needed by people with HIV and AIDS are only available several kilometres away in the city centre. Even if the services are free, people don't necessarily have the money for transport. And that's just one of many barriers that people face. Healthcare activists say that the world's fight against HIV and AIDS is failing to deliver the required services, in particular to children in the world's poorest communities. It's the US government that funds most of the world's response to HIV and AIDS in poor countries. People at this clinic are among millions receiving free medication that stops HIV from being a death sentence. The diplomat in charge says there's enough money.
We've been on basically a flat budget since 2009. In 2009, I think we had about 4 to 5 million people on treatment. We now have 15.7. That doesn't happen without developing amazing efficiencies and effectiveness.
But campaigners say those efficiencies are costing lives. HIV testing is crucial. For newborns, it needs to be immediate. But few clinics are equipped for that. Sending blood samples to central testing facilities can take weeks.
We call upon government and development partners like PEPFAR to scale up point-of-care testing for these children to ensure that they get the results real-time, and then we're able to intervene in real time to prevent the new infections.
Babire could have been spared from HIV if only the right healthcare services had been delivered. Campaigners say hundreds of thousands of children like her are dying. Drugs have saved millions of lives, but the fight against AIDS isn't over. Webb, Al Jazeera, Kampala, Uganda.